I'm going to just do a brief overview of diabetes, and probably a lot of it's going to be stuff you guys already know, but we're going to tie it into things about oral health. So let's talk about oral conditions in diabetes. The common theme tonight is to remember that the mouth is the gateway to the body. So healthy mouth, healthy body. Often our poorly controlled diabetics often have a dry mouth or xerostomia, and that causes multiple problems. Makes it hard to chew food, swallow, and sometimes even talk. And dry mouth can lead to other oral conditions. It can lead to cavities. Another thing often associated with reduction of salivary flow or dry mouth is burning mouth syndrome. I usually see this a lot in my denture, people who wear dentures or partials, and usually it's due to a secondary yeast infection because there's no saliva in the mouth. This is when someone who's got like a burning mouth syndrome. You can see their tongue looks really red. This is normal tissue, okay? See how this is nice and pink and like a coral pink. And so diets high in carbohydrates and acid are bad. This is a patient who I know is probably drinking a lot of high sugary type beverages. If you look at this tooth, when I'm just looking in the mouth and I'm examining a patient, this tooth looks fine. But this is what that tooth looks like on x-ray. This is tooth decay, all this, okay? And as you can see, the decay extended into the nerve. Now this tooth needs a root canal and a crown. So cavity treatment and prevention. Remove the decay and bacteria, restore the tooth with a filling or crown if too much tooth structure is compromised. And the way to prevent cavities would be to maintain oral hygiene, routine professional cleanings, routine dental x-rays, and fluoride application at home and in the office, and of course diet and habit modification. So the next thing usually you see with diabetic patients is gum disease. Basically, the definition will be a set of inflammatory diseases affecting tissues and bones surrounding the teeth. If not treated, will result in loosening and or loss of teeth. And it's caused by bacteria that adhere and grow to the teeth. Gum disease is one of those things that causes constant inflammation in the body. And once again, it's kind of like we talked about with infection when it related to teeth. It can make it hard to control blood sugar because of the constant inflammation. People that have diabetes have gum disease. People that have gum disease have diabetes. There's been studies where they took people who had periodontal disease or gum disease and diabetes and not put them on any kind of medication and just cleaned their teeth and got rid of the gum disease and showed that all of a sudden they were better able to regulate their blood sugar. So signs and symptoms of gum disease. Redness and bleeding of the gums, gum swelling, bad breath, teeth looking longer. Used to hear about people saying they look long in the tooth when they age. Deep pockets around the teeth, okay, and then a bad taste in their mouth, which is related to the constant infection and pus coming out from those deep pockets, and of course loose teeth. So diagnosis of periodontal disease is done by examining the teeth with x-rays and measuring the tissues around the teeth. So a lot of times we bring you in, we take a little probe and measure around the pocket depths of the teeth. And we're looking for bleeding, we're looking for how deep the pocket is, we're also looking for pus. This is a healthy gum tissue. See how this is nice and pink? This is unhealthy gum tissue. This is a more severe case. This is tartar or calculus on the tooth. So treatment and prevention of gum disease. The best way is to go in every 6 months or sometimes every 3 to 4 months for professional dental cleaning. If it's been a while and you have some of that tartar on there like we showed you in some of the slides that's progressed, you need what we call scaling and root planing. My patients who have their teeth are usually healthier. They usually have an easier time regulating blood sugar. And I think that's because they have a better diet. I have several patients in their 90s. Most of them have only lost 1 or 2 teeth in all their years. And they're just as healthy as they can be. Be proactive. Stay healthy, okay? Stay as healthy as you can. Go see a dentist routinely, whoever it is. Reasons people, including diabetics, don't go to the dentist. There's lots of reasons, okay? The big 3 are fear, okay? Money and time, okay? Fear. So there's all kinds of things we can do to get people happy, happy and comfortable, and where they feel good about coming to the dentist and get things done. The other thing's money. Things are tight. People are living on fixed budgets and fixed incomes. We work with people all the time because we know we have to. Time. There's never enough time, okay? You just have to make time. So just remember, mouth is the gateway to the body. So a healthy mouth, healthy body. Okay? You can always call me. or email me. I'll be glad to get back to you guys with any questions you have, or if anything comes up, I'll be glad to talk to you.
Thank you very
Thank
much.
you.
Thank you very much.